Hello, Mr. Jones. My name is
Hello.
Jennifer, and I'm a nurse, and I'll be taking care of you today
How long have you been nursing for?
for a couple of years now.
Mm-hmm.
What brings you in today?
I'm just here for my checkup.
For your annual exam?
Wife says to get the annual exam again.
Okay. Do you have any prior conditions or any known medical diagnoses?
Got onset diabetes right now. Yeah, I had smallpox when I was a kid.
Were you diagnosed
Chicken
with
pox.
diabetes? Chickenpox as well? When were you diagnosed with diabetes?
About 4 months ago.
Okay. Do you take any medication for the diabetes?
Nope.
Nothing?
Insulin.
Okay, you do take insulin. Okay.
I guess that's medication.
Okay. Do you um, manage with diet or exercise or anything like
I
that?
do a bit of diet and exercising.
Okay, so you've changed your diet a little bit?
Yeah.
Okay. What about as far as do you have like increase in thirst or urination or
The increase in thirst, urination, and I've been eating more.
okay. Okay. Do you have any other that those are the only
Yeah,
things?
those are the only things.
Okay. Have you had any surgeries in the past,
Yeah,
Mr. Jones?
I broke my kneecap last year.
Okay, and you had
I had surgery on that. I had to go under.
okay, and then you did physical therapy for some
Yeah,
time
I had a
after that?
bunch of steel plates in there.
Okay. Okay.
Feel it in my knees a lot.
I bet during the winter months especially,
Yeah,
huh?
yeah, it gets cold and stuff.
Right, right. So the insulin's the only medication that you take on a regular basis, Mr. Jones?
Yes.
Okay. Do you take any over-the-counter medications such as ibuprofen, Advil, something like that?
If I get the headache, I'll take an ibuprofen.
Okay. And how often would you say you take the ibuprofen?
At least once a week.
Once a
I
week.
always get headaches.
You always get headaches?
Yes.
Okay. Do you take any vitamin supplements or herbal medications of any sort?
Well, my wife got some vitamins. I've been taking those vitamin C.
Just a vitamin C. It's not
Yeah,
like a
all around. No.
it's not like a men's supplement, something
No.
like that. Okay. Okay. Do you have any allergies? Any food allergies?
I have a peanut butter allergy.
Okay, so you are allergic to
Near
peanuts.
butter. I'll
What
swell
kind
up.
of reaction do you get to
Yeah,
that?
everything swells up.
Okay.
It's very bad.
Do you have to take something like Benadryl, something like that, or is it more
I just
extreme?
keep the EpiPen.
Okay, an EpiPen. Okay. Have you ever experienced any pains, chest pains, headaches, anything like that?
Chest pains, headaches.
Both.
My
Okay.
knee.
Okay.
That's mainly it.
When did you start? How long have you had the chest pains? When did you start experiencing chest pains?
I've had the chest pains now for about 6 months.
Okay. And does the pain radiate anywhere else in your body when you're?
Just mainly the chest.
Okay.
Left chest.
Okay. And how is your hearing, Mr. Jones? Do you?
It's gone really bad over the past few years.
Okay. Do you experience like ringing in the ears, or you just have a hard
my
time?
right ear, just constant ringing.
Okay. Do you have troubles hearing? Do you notice that you have to turn up the TV or the radio?
I got the TV at a solid 50.
Oh my.
Wife complains about it all the time.
I'm sure. I'm sure. How is your vision, Mr. Jones? Has that changed at all, or?
Oh, it has definitely gotten worse. I won't admit it to my wife, but it's definitely gotten worse.
Okay. Do you wear glasses or contacts on a regular basis, or?
Because my wife finds out, she's gonna scold me.
Do you have difficulty breathing? Like during the day?
At night, I have a machine.
Okay, so like a CPAP machine that helps you. You have to wear the mask. Do you have a problem with that?
No.
You leave it on and
Yep.
everything's okay?
Yep.
Okay. Okay. What about as far as do you have any difficulties performing daily activities? Like
Going up the stairs is a little bit trouble.
Does it causes you pain or?
I'm just exhausted by the time I get up.
Okay. It's just going upstairs. It's not like any other. Okay. Okay. Do you have any balance issues or any recent falls,
I
anything?
fell about 5 days ago.
You fell where?
Down the steps, hit my head on the wall.
Oh my.
I was all fine though.
Okay.
My wife was
And
trying to get me to the doctor.
so you didn't go to the doctor after that fall?
Not after the fall,
No.
because I knew I had this appointment.
Okay. Did you experience any mental changes or anything like that from the fall, or
No, everything was fine.
everything seemed fine?
Mm-hmm.
But you didn't get checked, so okay. Um, do you have any bladder control problems?
I pee quite often.
And it's increased recently?
Oh yeah.
Okay. Well, the diabetes would do that, so that's one of the concerns that we would have. Do you have any problems sleeping?
No, sleep good.
Yeah. Okay.
Sleep good.
Okay. Other than the snoring.
Yeah, that doesn't bother me.
Do you have any problems with memory loss?
Can't remember what I ate today, so probably.
So you experience this on a daily basis? You
Yeah.
have. Okay.
I have to bring up events, and I just don't remember them that happened.
Okay. Is this something that's gotten progressively worse
Yeah,
over time,
about
or
age of 40 that started losing it, but now I definitely can't remember things.
okay? So it helps to have a support person like your wife around to.
Yeah.
Good. Good. Do you use any tobacco, any smokeless tobacco, like a
I
vape?
smoke some cigarettes.
How often do you smoke?
About a pack a day.
A pack a day? And for how long have you smoked?
Since I can remember.
Okay.
Wanted me to quit with the diabetes, but it's just hard to wean off.
Right, right. We're going to have to give you some information about smoking cessation. That's very important, especially at your age with the diabetes and now the recent problems breathing and the chest pains. And you've heard all this, right?
Yeah, my wife says it every day.
Do you drink alcohol at all?
Yeah. I get into the bottle.
How frequently?
I've definitely cut back on the alcohol, but I used to drink up until about a year ago every day.
Every day, like consuming like
full-blown alcoholic.
Like hard alcohol or beer
hard alcohol, strictly.
Like how much would you say that you consumed? Like a pint or?
I could go through a bottle of Fireball in about an hour. And then drink in 6 hours.
And you cut back when?
Oh, that was my younger days, but now I've cut back about a year ago.
Okay, good. That's really good to hear. Do you use any recreational drugs, Mr. Jones?
Smoke a little marijuana.
How often?
Every day.
Every day.
My wife says it's good for me. She's the smoker.
Okay. Have you had any hospitalizations in the last 90 days?
No hospitalizations.
Okay.
Been all fine.
Good. Do you have a family history of any medical diagnoses or illnesses, like your parents, your grandparents, brothers, sisters?
My mother had diabetes.
Okay.
My brother had diabetes. He had the one you're born with, but my mother had the type 2.
Okay. So there's like a family history of obesity in your family?
I would say, yeah. The Jones are pretty fat. Okay.
How about your grandparents? Like your mom's?
Grandparents, I think my grandpa had diabetes too.
Okay.
He's a bigger man.
Your mother's father or
my mother's father.
Okay. What about your mother's mother?
She was fine. She lived to be pretty old.
Good. What about your father's father?
He lived to be pretty old too. He was fine.
No medical.
Everybody on the father's side was fine.
So your father's mother was also?
Yeah.
Okay.
Straight as an arrow.
Okay. When was the last wellness exam that you had? When was the last time you saw a doctor?
6 months ago.
And what were you seen for?
The diabetes.
Okay. But before that, how long would you have said that it would have been?
About a year from then.
Okay,
I had
so
not seen a doctor for a while then.
Okay, so you go pretty regularly on a routine basis, at least once a year to be seen?
Yeah.
Good.
It's
That's
in the
really
health
good.
insurance.
Good, right. What is your current living situation, Mr. Jones?
Me and my wife have a house.
Okay, so you have a house. Is it a 1-story house, 2 stories?
It's a 2-story house.
Okay, and your bedroom's up on the 2nd story or the
Yeah.
1st story? Okay.
It's on the 2nd story.
Is there a bathroom upstairs on the 2nd story?
Yeah.
Okay.
There's a bathroom up there.
Okay.
So once I get up the steps, it's fine.
Okay, that was my concern was with the recent fall. I wanted to, I don't want you walking in the middle of the night to try to go to the restroom and have to go down the stairs and then experience more falls. So,
Yes.
Okay. Do you feel safe at home?
Yep.
Yeah.
The neighborhood's getting a little bad, but
Yeah. Okay.
other than that,
Good. And you're up to date on your immunizations and your vaccinations?
yep, all up to date.
Okay. Have you had a recent tetanus or a flu vaccine or anything like that?
A year ago. The doctor visit 2 times ago.
Okay.
Yes.
And you had what?
The flu vaccine.
Okay.
The new one. And a tetanus shot.
And a tetanus. Okay. I would recommend that you get yearly flu vaccines just from now on.
All right.
Did you have any childhood illnesses like chicken pox?
Yeah, chicken pox.
You had chicken pox?
Yes.
Okay.
They say I can get that shingles.
Right. That's exactly right.
Yeah.
How many different sexual partners have you had in the past year?
This is between you and us, right?
Absolutely.
4.
4.
Different.
Okay. Were they men or women or both?
No, they were all women.
Okay.
Don't tell my wife that.
No. Do you snore, or has anyone told you that you snore, Mr. Jones?
Yeah, my wife says I snore.
Your wife says you snore all the time?
Yeah.
Quite frequently?
Yeah, she even got those plugs to stop it.
Right? Okay.
Doesn't work.
Doesn't work.
Blow them right out.
Blows them right out.
Yeah.
Okay. Do you have any questions for me, Mr. Jones, or anything, any concerns?
When should I schedule my next one? 6 months, a year?
Well, you should at least be seen once a year, but we'll probably have to do a little bit more testing on you, more blood work, things like that, with your condition changing in the recent.
Yeah.
Okay, so those will be concerns, different things that the doctor can come in and discuss those with you, but just so you know, so that you're aware that these can be circumstances that can come up. So, and they'll have to review things further. You have to get, like I said, blood counts. You'll have to get probably a chest X-ray, to make sure everything's okay. Do you have pain? Are you experiencing any pain other than the headaches? Any, like a constant pain at all?
Sometimes when I urinate, I get a little pain.
Is it like a burning sensation, or it's just...
Yeah, a little bit of burning.
A little bit?
In the urethra. Okay.
With these other partners that you've been intimate with, are you using protection?
No.
Okay, so we'll probably have to do like urine tests, things like that, just to let you know that we'll have to cover everything. So you don't have any other questions?
As of now, I think I'm good, but I don't know.
You don't know? You just want to get everything situated and find out what's going on? Okay.
I had to do blood work at all recently?
Mm-hmm. Yeah,
blood work? When do you think that'll have to be in?
Well, they'll draw the panel and check everything, and then usually you get your results within 48 hours. I can give you a pamphlet. You can log into the system so that you can view, all of your results. And if you have any questions, you can feel free to give us a call or I can give you the number and all the information, the pertinent information that you need to do those things.
All right.
Okay.
Sounds good.
Okay.
Thank you, Miss.
Absolutely. I thank you for all the information you've given to me today and your time. And the doctor should be with you shortly.
All right. Thank you. Madam,
Certainly.
don't tell my wife about my partners.
No. Everything that you say is confidential. Okay, Mr. Jones?
Yes.
Thank you.
Thank you.